Hi, my name is Linda Suleiman, and I'm an orthopedic surgeon specializing in hip and knee replacements at Northwestern Medicine. Today we're performing a robotic-assisted Mako total knee replacement. For the patient I'm operating on today, we'll be using the Mako for gap balancing. So when we make our initial plan, we'll be balancing the medial and lateral aspects of her knee, and we'll have millimeter accuracy on knowing what that balance is going to be. Some of the clinical benefits of having a robotic-assisted knee replacement is faster recovery for the patient, more accuracy in your cuts, given that you have an assistive saw blade technology, as well as haptic boundaries, as well as more accuracy in your balancing and positioning of your implants. So some of the new research that we're looking at using the Mako is that we're able to store the data. So we know exactly what implant position we've placed the knee, and we were able to record that into the robot. So we're able to use long-term data if we were to do kinematic alignment or some of the newer techniques in total knee replacement. For fellow orthopedic surgeons, what you can learn from the Mako is it's another device, another assistive technology to help you be a better surgeon, have a better accuracy in your saw blade cuts when you're performing a knee replacement, as well as balancing of the knee.